Welcome to Sign for the Times. The Society for the Involvement of Good Neighbours, commonly known as SIGN, is a not-for-profit agency in Yorkton, Saskatchewan, Canada, that provides 24 social and community programs and services. Those services range from daycare and before and after school programs to parenting and family support, from senior mobility to assistance for those living with HIV, from housing support to vocational employment, from walk-in counseling services to Indigenous cultural programs, and more. SIGN sees its mission as providing leadership, programs, and services that assist, support, and empower children, adults, and families to achieve lifelong success. That, we feel, will lead to strong and caring citizens and communities. Our podcast will explore those programs and will include conversations with people who have accessed the services. You will hear firsthand about the issues they have faced, but more importantly, how they have successfully managed or overcome them. My name is Dick DeRyck. Today we are talking to Andrew Sedley, the Executive Director of SIGN, about the impact of COVID-19 on the organization, on the people who access the services, and on the staff. Andrew is in his 10th year as CEO of the organization, and I would suggest, Andrew, that this year has been unlike any other in the past decade, and probably unlike anything you could have ever imagined.
Yes, actually, Dick, it's been quite a change, and something that we've always had our pandemic plan in a binder, ready to go, but never expecting that we'd have to utilize it. And
you actually have to take it off the shelf this time.
Absolutely. And that's one thing, though, that we always look at and update each year. And so we had to utilize that in the third week of March. We really changed a lot of our services and sending staff home and using a more virtual way of providing services to service users here in our communities and those that offer programming here at SIGN. But for us, it was a huge change because we provide supports. Historically, it's been face-to-face. When you're looking at helping individuals, that sort of thing, that's always been kind of the way to do is sitting down, listening, working with those individuals and finding solutions to some of the issues that they're facing. And so when COVID hit in March, it did change quite a bit what we were doing on a service level, as well on a governance level with our board. When we look at usually our board meetings are face-to-face, and all of a sudden we're using technology to still govern our organization. And even our AGM this year, we utilized a virtual approach, and which again was a first for us, this organization, over our past 50 plus years.
So March came around, and obviously the pandemic was a major problem that not only SIGN but everybody else was facing. SIGN has a number of relationships with government organizations, with provincial government. It does work under contract to the province. So I'm assuming that at that point you basically had to follow whatever directions and would want to follow whatever directions were provided by various levels of government.
Yeah, absolutely. And the transition to virtual services wouldn't have been successful without that constant communication that we had with our funders, the provincial government, locally with our public health offices. Cannot say enough positives about that communication, how we're able to work together and ensure that we're still offering those services that are needed here. It really was amazing just to see, the different government agencies, health, that sort of thing, always willing to assist and support us throughout our process and planning as to how we provide services in a safe manner for those here.
Well, it was new for everybody, right? Who could have anticipated that?
Oh, absolutely. It was definitely a a lot of changes that were made, and sometimes they were every day, every couple of days, but really trying to follow the guidance of public health and our funders, and ensuring that we can still provide those services that we needed.
What was the reaction of staff? I mean, like you said, everybody's used to doing face-to-face meetings. That's basically how counseling and this kind of support services are provided. So, was there fear? Was there a trepidation, or were people quite understanding and prepared to start adapting?
Well, change is always difficult, and when we talk about a pandemic and looking at sending people to work from home, there's always just that little bit of unknown and not quite sure what's coming up with that. Not only are staff worried about, how they can provide services still to clients, that sort of thing, but also, their family, ensuring the families are safe and that sort of thing. Another change with the closure of the schools. So now we have children of staff members that are at home too. And so staff are kind of doing double duty as well with ensuring they're able to provide care for their children at home and that sort of thing as well. So it off the start, it was difficult, and I applaud the staff that have been able to really transition and I think really grow some of the programming that we offer here. From what we were able to do, and thankfully, but upgrade our technology. So staff were able to work from home. We were able to, log into our various computers in the office and still provide those supports and have that communication. We started to have more regular staff meetings as well, just as a touch base with staff and ensuring staff are okay, and because it's new for everyone, and we really think by keeping everyone connected, it's been beneficial that way as well.
Some of the programs of necessity had to stay open. I'm thinking of the Early Learning Center, the daycare center. I think we continue to operate senior mobility, trustee services, because people depend on the finances that they receive through the trustee services. So some of them did stay open.
Yeah, absolutely. And so for those programs that did stay open, really trying to follow the strict health protocols we needed to have in place to ensure that we're reducing the spread of COVID-19. And so with the daycares off the start, followed the guidance of the Ministry of Education Early Learning. And they had reduced the numbers of children. We moved to daily screening, daily temperatures, masking when needed, those sort of things, and really ensuring that we're kind of doing our part that way. And some of our other programs, when you look at, senior mobility, we still had seniors that needed to get to appointments in the community and that sort of thing. When we're seniors, sometimes they're some of our most vulnerable individuals. And so really transitioning that program again into, the screenings, the temperature checks before they're coming into the vehicle, the sanitization before and after, and really still trying to get our seniors to their appointments where they need to be. A lot of the, health appointments off the start were canceled, and but seniors still needed to get to the bank, or they needed to get groceries. And so we really tried to assist seniors in providing those not only transportation supports, but also trying to offer assistance for getting groceries, that sort of thing for them as well, because we want to keep them safe as well. We also, with the Senior Mobility Program, partnered with the Boys and Girls Club. So the Boys and Girls Club had food packages and family resource packages that needed to get out to families, because they had shut down their operations because of the pandemic as well. And so working with the Boys and Girls Club, we were able to get those packages. Once a week, we would have our senior mobility drivers do a curbside drop-off at individuals' homes that needed that extra support and assistance as well. When you mentioned trustee, many people, well, 70 individuals rely on that program for their checks and ensuring that they have bills paid and that sort of thing. And so that's another program that, we continued to operate. We did it through a more of a drop off of checks where we hand a person a check through a mail slot and they would pick it up. And it seemed to work fairly well and still working fairly well with that. Another program that really we had to keep operating was our adolescent group home. It's a residential 24-hour care facility for young people. And so, again, it's a lot of the mask wearing, the staff screening, and trying to, calm the fears of the adolescents in the group home as well. Our young people, it's an unknown for them as well. And ensuring that, we're there to support and assist them through this pandemic. So, I'm proud of the programs that we're able to continue to offer those face-to-face. And for those that went to virtual, it was amazing to see the transition once we were able to start those virtual programming, and just seeing the supports that we were able to offer was just amazing.
Well, yes. Family Resource Centers, in Yorkton, the early years Family Resource Center at Sign on Broadway, and as well as the Family Resource Center in Kamsack, I think we're among the first to really get into the virtual programming in a big way. All-in-one family cultural programming followed, Triple P, positive parenting, youth life skills. It was quite a transition, and it seems to me it was quite successful. That they put in the effort, and the people who depend on those programs, joined in quite quickly.
Yeah, it was amazing to see the even the family resource centers in Yorkton and Kamsack. Every year in the past, at the Yorkton Family Resource Center, we offer summer camps. This year, with not being able to do face-to-face, we started up a virtual summer camp. And so there was kits that were created for children and for families with art, science, Zumba, cooking, cultural activities, those sort of things in there. We had held a curbside pickup. And it was really great to see families still wanting to be involved in the Family Resource Center and the programming that's being offered, and to do it in a more virtual way. Likewise, our Family Resource Center in Kamsack worked remotely from the center and provided supports throughout the pandemic, and continue to do. Most recently, they've received a large donation of books. And so they were able to do curbside pickup and delivery of books for families in Kamsack. And so being able to still provide those supports and just doing it in a different manner is really what we wanted to see, and ensuring that we're still able to affect positive change for families, that sort of thing. Some of our other virtual programs, as you had mentioned, the all-in-one family cultural programming, Triple P positive parenting, life skills. Again, we were seeing a change in the way that we currently do things. Those were all, face-to-face supports, whether it was Triple P groups, the all-in-one family cultural programming. And so we really were able to change that up to offer virtual, and we've seen some real successes out of that. We've seen increase in individuals accessing some of our programs. And, this is, I think, due to offering services virtually and online instead of just the face-to-face. It seems that, there could be individuals that maybe don't have transportation to get to a group or whatnot. And we were seeing people from all over the province joining our groups. And we even had some from out of province that had joined some of our groups just to learn more about whether it's parenting, and really making a concerted effort to engage in the programming and be a part of the program that Sign offers. So it was great to see just kind of the people were still reaching out, accessing services, and being able to do it in a different way.
Well, and I think one of the things that the program managers heard from people was that if you do it virtually, the people that are participating don't have to worry about A, childcare, because they're doing it in their home, and B, transportation. Because both of those are sometimes are impediments to people participating in programs if you can't get to the program or if you don't have childcare. But if it's done virtually, assuming that they have the technology available, and I think that was, that's one of the prerequisites that for some people would have been a problem. They don't have, either the connection, the internet connection, or the computer equipment that's necessary. But for others, it alleviated some of the problems they might have with face-to-face meetings.
Absolutely. And, we heard, that with some people that maybe didn't have those internet connections in rural communities, or maybe not that technology, we had a number of individuals then that would phone in for different supports. And so, we did the web-based virtual programming, but also providing those supports over the telephone. Many of our programs had individuals that would just call in, or we would call them just to check in, see how things are going, and offering our supports as we can with it too. So, the pandemic has made Sign really rethink the way that we're providing our services. And, by over the past, it's been 5.5 months, 6 months now that we've been utilizing this virtual services. It's just another tool that we've added to our toolbox now to assist individuals. And so it's something, when I look forward into our future too, this is something we're going to be utilizing quite a bit.
You had a very successful walk-in counseling program that got some significant government support just in the past year or so. But it was walk-in counseling, literally. Appointments not required. That then obviously too had to change and went to call-in counseling, with telephone based.
Yes, we when the pandemic hit and we moved to that telephone based, as well as a virtual, we gave people the option of at least seeing who their counselor is and talking with the counselor over the computer. But when the pandemic hit, we really seen a sharp decline for the first few weeks. And, I think a lot of individuals, families were just making sure that they were safe and doing what they needed to do. But what we've seen lately is a sharp increase now again in those calls coming in for people needing some supports. And so we're currently, majority of ours are over the phone. When people call in to talk to a counselor and given the option of telephone or web-based, they're on the phone already. So it seems to be kind of the way to go right now is just providing that support and counseling over the telephone right now. Again, it's not the same as that face-to-face, but we're able to have individuals connect with a counselor and talk through some of the issues and crisis they may be going through. So we wanted to ensure that we can still connect to those individuals and let them know that we're here for them, whether it's face-to-face in the past to telephone or virtual now. It's something that we want to continue to have individuals connect when they can.
Some of the couple of programs had to shut down completely. I'm thinking of the meeting room. Sign on Broadway rents out meeting rooms to other organizations, and that provides rental income. It provides income for the organizations, and that had to shut down. And of course, the before and after school program, when the school shut down, it shut down as well.
Yeah, and with the before and after school programs, we followed. With the schools shutting down, we had to act quickly and work with staff on that. And one of the interesting things is with the reopening of the schools and ensuring that we have a safe reopen plan for our before and after school programs. We've had our staff working a lot of hours over the summer, where usually the summer with school closed, they're off. But they've put in a lot of time and a lot of effort just to ensure that when the schools do open up here shortly, that the before and after school programs are following school protocols as well as sign protocols to ensure that we have that safe environment for the kids when they come back to school. You also spoke about the meeting room rentals at Sign on Broadway. Because it is a former hotel, a lot of those training rooms that were in the former hotel and now Sign on Broadway have been in the past quite heavily utilized by community groups, businesses for meetings, trainings, workshops, those sort of things. And so as soon as the pandemic hit and we shut down, we had stopped all of our rentals with that. It did give us a good opportunity, though, to start planning for that facility and how we can have a safe reopening whenever that is, to ensure that when community members are coming into that facility, it's a safe place to come. And so staff over the past number of months have been busy with not only sanitizing that sort of thing, but working with public health on traffic flow in that building. It's a large building, ensuring that we have the glass up at our front desk areas, those sort of things. So when people come into the building, ensuring that we have those safety precautions in place. And so although we did shut down meeting rooms, that sort of thing, our staff went into high gear to plan and organize and ensure that safe reopening. And it reduced the income that the organization received through meeting room rentals. But what it did do was give our staff time to get things ready for when we do reopen.
Right. How did staff generally react to working from home? I know I've talked to a few of them, and they seem to, as you mentioned earlier, they have their own childcare issues at times. They seem to have to like it wherever it's possible, but they also realize that a lot of the work that they do is better done face to face. But they seem to enjoy the ability to work from home whenever that is practical.
Yeah, absolutely. It off the start, it was difficult for everybody, but the more we got into it and seeing how we could still provide those supports and seeing that we're able to do it effectively and doing it virtually and remotely away from the office, we've seen some really good benefits from it. And so, staff see benefits at times as to, when they can work from home and that sort of thing. I think it's really going to change, even the whole way that we've done business in the past. In the past, it was you came to work right in the morning and you stayed till end of day. And with the pandemic, we're seeing, and the working from home, we're seeing that there is options available for staff if they need to work from home for whatever time it is for it, and then also to be sharing that time in the office as well. And so when we look at, even just work-family balance and, with different things going on, we've realized that there's a way to be able to have staff work from home if there's something that comes up and they need to be at home. And so it's really transitioned the way I think Sign as an organization moving forward will be looking at how we work.
You've started a slow and careful and gradual reopening. None of us really know what is going to be normal in the future. We talk about the new normal. But obviously at some point, and it started everywhere, I think probably more carefully in Canada than in other places, but you're getting ready to do some reopening, and some of the programs have started to reopen. Are you comfortable with where this is going and the speed that it's going at?
I really am. I would rather that we be cautious, ensure that we have safety measures in place, and that we're doing our part to curb the spread of COVID-19. Last year alone, there was over 6,000 unique individuals that accessed one of Sign's programs. So that's a lot of individuals that are coming and going, that we're in contact with on a daily basis. And we want to ensure that we're doing our part to reduce that spread of COVID-19. And so, it's been a slow process, a lot of planning, a lot of communication with public health, a lot of gathering of PPE, hand sanitizers, those sort of things, getting all that stuff ready and in place for when that reopening does happen. And, it's been 6 months or close to 6 months, but we want to ensure that we are doing our part for our community, for our clients, for our staff, to ensure that health and safety is number one priority for us. And, whether it's masks and staff screening, hand sanitizing, ensuring physical distancing is happening throughout all our facilities. We really want to ensure that we're doing what we need to do to be a leader in our community and in our province for providing these such much needed services, but doing it in a healthy and safe way as well. So, it has taken a while. Staff, I think, have to be highly commended for the amount of work that they've put in, and the input they've given into what the reopening would look like. And like I say, or like it's been a long process, but it's something that I'm comfortable that when it gets to that point, when we do reopen our services, we're doing it in a safe manner.
Do you have timelines? Are we thinking September, October? Where do you see this gradual kind of thing starting to, being able to tell people that, yes, some of these programs are now, we're back to a new normal, not the way we did it before, because like you say, all the precautions need to stay in place. But do you see this happening this fall and into winter?
So, yeah, I would think so. Currently, right now, what we're doing is programs are providing their reopening plans. We're ensuring that each of those programs' plans meet public health guidelines, ensuring that we're doing our supportive services in a safe manner. So plans all have to be in by next week. We're going to be reviewing all those plans, ensuring everything's in place. What we've told staff as well, it's not we're not going to call a staff meeting and say tomorrow 8 a.m. everyone's back to work, but give staff a minimum 2-3 weeks notice to ensure that they're able to get things that they need to have in order as well with it. Because for the past almost half a year, they're working from home. So it is, again, a lot of a shift for them. So want to give staff time to do that and just ensure that all that's in place before we do that reopening. But I would expect that, yes, in the fall that we would be looking at providing those face-to-face when we can. And because we know there is still a lot of benefit to that face-to-face. Now, the other part of that, though, too, is, if things that have been working in the past virtually are working, continue to do that. Use that virtual as way of providing services as another tool that you have in your toolbox. So it's not all of a sudden where, staff need to be back full time, that sort of thing, but to, whether it's in the office for a while and then doing some virtual supports, that sort of thing. We want to ensure that we're still being safe. We're still providing our services that we need to be providing in our communities. So it's really going to be, I'm hoping, a mixture of both face-to-face and virtual moving forward.
Thanks, Andrew. This has been very, very informative. Thanks for your time and for your the support that you and the staff at Sign provide to the community. It's I'm sure everybody is looking forward to getting a little closer to what used to be normal, with the realization that it may be a long time before things are back to what they were before.
Absolutely, thank you, Dick. It's we don't really realize how much face-to-face contact is still so important to individuals, and I know our staff are excited to provide some of that face-to-face when that time comes, and even as coworkers, just to see each other again. And it's a lot different than seeing everybody once a week on a computer screen. And so we're looking forward to that time when we can meet together again.
New Sign for the Time podcast will be available at least twice a month. We hope you will continue to tune in. If you have comments or suggestions, please feel free to email communications@signyorkton.ca or use the contact options on our website at www.signyorkton.ca. We are also on Facebook, Twitter, and Instagram, all at Sign Yorkton. Thanks for listening. We will talk again soon.